Welcome to Healthbeat, your monthly check-in on South Africa's healthcare system. I'm Malan. This month we come to you from two Western Cape clinics. One of them, the largest HIV treatment clinic in the city of Cape Town, with over 5,000 people on antiretroviral drugs. Our health department is dealing with the fallout of US government funding cuts, a move that has severely affected treatment and prevention programs. Health Minister Aaron Motsoaledi has been criticised for not doing enough to come up with a plan, but he has tried to plug the gaps with extra funding.
Treasury has come to the party. You have asked me in the committee many times. Treasury have allocated 553,528,000 for us to start the process. This money consists of 590 million, which goes to provinces, 32 million, which goes to national, and 132 million, which goes to researchers in our universities and research institutions. Because the Bill and Melinda Gates Foundation, together with the Wellcome Trust, have given us an offer. They said each one of them can pay 100 million rand for research, provided that our treasury must add 200 for every 100 they've given. This has been accepted. Treasury is going to add 400 million rand.
But it's a far cry from the almost 8 billion rand South Africa was going to get from the US this year. One way to ease the pressure is to give patients longer supplies of ARVs. The idea is to give some patients 6 months worth of medication. This means they only have to visit their clinic twice a year instead of every 2 or 3 months. A few Western Cape clinics started doing this in January. The rest of the country will only follow in August. Naliswa Nkwali, a member of the Treatment Action Campaign, was among the first patients to take up the offer of getting 6 months worth of medication at a time, known as 6-MMD.
I was diagnosed HIV in 2000, and then I started my ARVs in April 2002 when my CD4 count was 39. So as part of the journey, we all know that people get treatment fatigue when it comes to treatment.
Naliswa's relationship with ARVs is a love-hate one. They've kept her well and helped her raise her children. But squeezing in clinic visits around a hectic schedule became too much.
You know, when you go around in the Western Cape, people start queuing from 4 o'clock for their appointments. Most of the time, I used to miss my appointment because of the time. Now that I'm taking this treatment for 6 months now, I'm fine. I can be able to plan and make sure that I implement my diary as it is written. It helps me a lot because I'm a kind of busy person.
These days, Naliswa's fight is to bring back the kind of support and counselling patients had when treatment programs had more money.
Now that we don't have resources, if we can start address the issue of the treatment literacy, I think the 6MDs will flow.
At the Wallazine Clinic in Kraaifontein, they've started to make the shift. Nontle Plaatjie makes sure clinics around here test and treat people for HIV, and most importantly, get them to take their medicine.
It all starts here. This is the ARV site. This is where the professional nurses and the doctors are here. Then we've got in-facility patients before they are decanted to clubs.
Clinic staff do the paperwork that used to be done by US-funded NGOs. Local organizations pitch in with counseling.
We had to train them. Of course, they didn't know what to do. Because what happened really, on the 27th of January, we started with a 6-MMD, 6-month multi-dispensing system.
So the reason you give him the 6-month medication is so that there's less pressure on the health system.
There's less pressure in the health system. There's also time for the patients as well. Remember, they take time off work to come here every 2 months. Now there is less time off from work. Remember, we've got a moving community. Most of the people are not from the province, they're from the other provinces. Sometimes they have to go to Eastern Cape and wherever. Maybe they go for a funeral and then they miss their appointments. But now with the 6MMD, okay, they can move freely. And at the same time, we've got long distance people, like your truck drivers, farm workers will be here. And then maybe in 2 months' time, they can't make the appointment because they are away for 4 months. Now that is the advantage of the 6MMD. The movement is easier for them and also less time spent at the facility as well. As you see, that trailer is empty now. It never used to be like that. It's a quick pick up now. There's less patients coming to the facility. We're decongesting the facility. We're trying to decongest the club as well.
If someone stops their treatment and they don't come back, what do you do?
So we've got an early missed appointment list that we're generating every week. We've got a late missed appointment list. Then we pick them up there. They do telephonic recalls. And then if there is no response from your telephone, a community health worker that is going to go to your house, okay, and give you a recall slip that you missed your appointment. You can go to the clinic with this slip.
Can you pick up in your health system? Is it digital that you can pick up where that patient went to?
No, we can't. We don't have a national reporting system. You may say that I'm lost to care, and yet I'm not lost to care. I am taking medication in Gauteng, I'm taking medication in Eastern Cape, but the system, the way it is devised, you can't see who's taking medication. You only can see what is happening in the Western Cape.
There's a digital system for the Western Cape. You can see if someone moves from here to another Western Cape clinic, but you can't see beyond the Western Cape.
Yes, we've got an SPV. SPV is a single patient viewer. That is in the Western Cape only. Then with SPV, you can see exactly what is happening with your patient. If your patient did not come to collect here, as I have said to you that you've got an early miss appointment, less miss appointment, then I will go to SPV, punch in that file number and look, oh, okay, she didn't attend here, she went to Ikwezi. She's receiving medication, she's not lost to care, she is in Ikwezi. I can see, but SPV is only in Western Cape.
So how do you qualify for 6 months dispensation?
We want people that are on TLD only. TLD is a regimen that is consisting of a tenofovir, lamivudine, and dolutegravir.
That's the first entry-level treatment.
Yeah, that is the very first entry-level treatment. So if you are in TLD, then you qualify to be part of the 6MMD.
So if you take your treatment for 4 months and you come back and you're virally suppressed,
yes,
then you automatically go to club and you get your medicine for 6 months.
Yes. Suppression is when you take your medication, there is too little virus in your body. So the chances of you infecting somebody else are very low.
After the break, we travel to the Strand in the Western Cape to find out how a government pharmacy prepared to hand out 6 months of ARVs at a time to thousands of patients.
We weren't sure as to if we were doing the right thing. We were finding our feet, making some mistakes, but learning from those mistakes.
Welcome back to Healthbeat. Here at Ikwezi Clinic in the Strand, thousands of HIV patients now only have to visit the clinic twice a year to get their medicine. Lindy McKenzie heads up the pharmacy and says the payoff has been enormous. So here in the pharmacy, what did you have to do to get ready to prescribe ARVs for 6 months for patients?
Before even committing to the 6MMD, we had to secure some stock from the Cape Medical Depot. We had to ensure that it was available for the clinic to order, and we had to ensure that it was in our possession before we could say, yes, we want to start. Then we had to have serious discussions as to how we were going to accommodate 120 ARV clubs.
What are ARV clubs?
We know that there's stigma when it comes to ARV treatment, and so we created these clubs for patients to feel included to get sufficient treatment firstly, and the counseling that they need. So one club basically comprises of 30 patients as a maximum, and here at Ikwezi we have a total of 142 clubs, of which 120 clubs were then scheduled for 6 MMD. 6 MMD required a special criteria, a special patient to get 6 MMD, so an adherent patient, a patient that has been on treatment and it's not a new patient, someone that we can trust with 6 months of medication. They are virologically suppressed. And so those clients, we had to make sure that they were moved into a club and no comorbidities whatsoever. So
What is a comorbidity?
a comorbidity is an additional non-communicable disease that the patient might have, such as hypertension, diabetes, anything in addition to having HIV.
So how did you get the clubs ready?
It was a team effort. It was definitely a multidisciplinary effort, including myself as the pharmacist, but we had to ensure that the club facilitators, the club champions, the clinical nurse practitioners, they were all basically moving our patients, looking at their blood results, looking at their lab results, and seeing were they virologically suppressed. If not, then they were basically kicked out of the club. And if you were adherent, if you were virologically suppressed, if you were showing signs that you don't have any comorbidities, you were then part of the club.
Now, once you had everyone who qualified for 6 months dispensation in the same club, what was the next step?
So the next step was then making sure that our patients are returning. We called it the transition period, finding our feet, making some mistakes, but learning from those mistakes. We weren't sure as to if we were doing the right thing. There was a bit of skepticism. Should we go all in with our 120 clubs, or do we take a bite-sized chunk of our clubs and start the process small? But looking back now, I think we made the right decision as to do all our clubs on 120, and we can actually see the benefit now.
What's the benefit?
Our main motivation for embarking on the study was that our clinic previously, 6 months ago you could even say, it was really congested and we had to declutter the clinic. Patients were calling for a different approach because they had to come to the clinic every second month, and you can imagine taking off work, traveling into the clinic, there's costs involved, there's hours of work missed. So trying to mitigate that and allow patients to get twice a year was a brilliant idea, and that's why we definitely said we want to start the pilot study at Ikwezi.
When people come for their medicine to collect it for 6 months, how does it work that day?
It's a very well organized system. So the day that you come for your clinical and blood visit, you get your dates, and it's scheduled on your card, your dates to pick up. There is a grace period of 5 days, which the club sisters allow for you to organize yourself to get to the clinic. You don't see the doctor, you don't have to wait at the queue in the pharmacy. You're literally just attending and you're picking up your parcel. Getting the parcel should take you about between 10 to 15 minutes.
Thanks very much, Lindy, for your time.
It's a pleasure.
Ikwezi's pilot project for giving 6 months of HIV meds will run until the end of the year. Sister Nomfusi Jange is the club champion. Hi Nomfusi,
Hi,
what are you doing here?
I'm separating my 6mm scripts with the comorbid ones.
How many of these are scripts for 2 months and how many are for 6 months?
I'm focusing on 2 months. She's doing 6 mmD.
What are the lessons that you've learned about rolling out 6 months dispensation that you think other clinics can learn from?
They must first be prepared, and they must just give everybody a task, and then we must work as a team.
What did the clinic gain from doing it so quickly?
For us here in the club, because we had to do 3 to 4 clubs per day, and we would sometimes see they would do the bloods and clinical up to like 2:30, and without taking a break in between, because we want it to be quick. So now at least we can just do it, and then by 12 o'clock is done, we can take our lunch, and after that we can do our admin.
And what do you do with that time now that you have extra?
I have a lot of, I must write the results in the folders of those clinical that I've seen it 2 days before, and I must also write the blood results in these registers. And Sister Golela must also continue prepping for each club, and she must do that 2 weeks in advance to give the pharmacy so that they don't get a break.
So you now have time to plan ahead.
Yes.
Coming up, 12 years ago, South Africa published a blueprint on how to hand out HIV medication for 6 months at a time. But so far, only a few clinics in the Western Cape have started this. So why has it not taken off?
We're the only country that has not started with 6-MMD. So most of the other countries, including all of our neighbouring countries, offer 6 months dispensing.
Welcome back to Healthbeat. In 2023, our health department issued guidelines on how to issue HIV treatment for 6 months at a time to patients. Since then, many African countries have started to do this, but South Africa is behind. Mostly only a few clinics in the Western Cape have started with this. Researcher Lynn Wilkinson is trying to change that. Lynn, thanks very much for joining us. So if you look at people on ARVs in South Africa, the 6 million people on ARVs, what proportion of them do you at the health department think will qualify for this 6-month dispensation?
I'm not sure what's in the health department's calculation. I would guesstimate probably sitting somewhere between 45-55% of our ART clients would qualify. Because remember, some of the clients are still new, some don't have enough viral load tests, others have health conditions or are struggling to take their treatment and are required to be seen more regularly. And then remember that not everybody who's eligible will actually choose to take 6 months of treatment home.
What do you think South Africa's goal for 6-month dispensation should be?
The long-term goal should really be to offer 6 months dispensing to every eligible client and enroll every single person who wants it. In the short term, look, we can't do it all at once. And so usually the departments of health will implement something in phases with sort of a slow ramp up. And I expect that's what they would do when they implement 6-MMD.
My understanding from the 2 clinics here in the Western Cape that we visited is that you'll come twice a year to collect your medicine, so once every 6 months, and then there would be an additional visit to do blood tests and test your viral load.
The Western Cape has decided to add that 3rd visit so that the viral load is taken before your next dispense. The rest of the country follows the guidelines, which specifically state that your viral load is taken at your visit so that we don't add an additional viral load. We take it at your visit. And if it's elevated, which remember is for very few of these clients, because these are stable clients who've had many suppressed viral loads, but for the few that might have an elevated viral load, they then get recalled to the clinic for care.
So if you say recall, does that mean you no longer get the medicine for 6 months? You now come to the clinic every 3 months?
Well, you would already have been issued the 6 months of treatment, but just in the same way as if your blood results come back showing that you might have TB or some other problem that needs to be managed, then those patients are contacted and recalled, which means asked to come back to the facility so we see that client, see what's going on. It also depends on how high the viral load is. If the viral load is only slightly high, then they can continue with their treatment with management along the side. If it's increased above 1,000, then yes, they will return to a shorter supply as well as more intensive clinical management. The guidelines say that your first viral load is taken at 3 months after treatment starts, and then your second viral load is taken 6 months later, so anywhere between month 10 and month 12. And then when you come back for your next visit after that, we look back and we see that you've got those 2 viral loads that are suppressed, and so therefore we can offer you 6 months dispensing, provided otherwise you're clinically well too.
Are there any other countries, especially in Africa, that have started with 6 months dispensation, and are there lessons we can learn from them?
Yes, many countries. In fact, we're the only country that has not started with 6 MMD. So most of the other countries, including all of our neighboring countries, offer 6 months dispensing. Their experience already shows that people stay in care very well and even do better retention rates, better viral suppression rates with 6 months dispensing. I mean, I can tell you that in mid-2024, sort of halfway through last year, PEPFAR was supporting 6.6 million people who were receiving 6 months dispensing, all in Africa.
What have our challenges been not to start if there are countries that are poorer than us who have started?
Remember that in South Africa, the government procures their own ARVs. They weren't procured by PEPFAR or Global Fund, which has provided a very important resilience in this time of funding cuts. And therefore, the department's been very hesitant to change their supply chain and only really feeling more comfortable now that everyone else is doing it well and the data is coming in to show the outcomes are good. I think a lot of the hesitancy has been around that, but I can't speak for the government.
Are there any other challenges that we can expect in the rollout of the 6 months dispensation?
We know from our experience of rolling out 3 month dispensing that it took a number of years for most people to be offered 3 month dispensing that were eligible. And I expect that we will have the same slow pace of rollouts. I really hope we can do it a little bit quicker than we did with 3 months supply. It's really important now at this time with US funding cuts. We already have staff shortages, but now those are even further exacerbated. And 6MMD really helps reduce the number of visits, therefore reducing the length of the queue in the clinic and just the whole workload on the health system.
Len Wilkinson, thanks very much for your time.
It's a pleasure.
From August, clinics across the country will follow Wallerstein and Ekwezi's lead. Finally, giving people with HIV 6 months medicine at a time.
The only thing that I can say now, at least to our government, we need to make sure that we have resources that address so that we can have better outcomes. People must go and grab the opportunity. Let's grab the 6MDs. It's working, it's doable, it eliminates time, so we need to do it. I do it, everyone can do it.
From Cape Town, that's Healthbeat for July. Share your thoughts with us on health@bikisisa.org.